Hello, everyone. I'm NewsNOW from Fox's Regina Gonzalez, joined today by CDC Director for Minority Health, Dr. Leandris Liburn, and Dr. Patrice Harris, who is the immediate past president of the American Medical Association. They're joining me from Atlanta to discuss a new national campaign this flu season called No One Has Time for the Flu. So, ladies, could you tell me a little bit about who is involved in this campaign and why it's really being launched?
Well, I'll start. Certainly, the American Medical Association is very pleased to partner with the Centers for Disease Control and Prevention, as well as the Ad Council on this very important campaign. We are, of course, appropriately focused on COVID-19, but we cannot forget that we are at the beginning of flu season. And October is a perfect month to get your flu vaccine. And so we want to raise the level of awareness around flu vaccine, make sure that everyone gets credible and accurate information, and encourage everyone 6 months or older to get their flu vaccine to protect themselves, their family, and their communities.
Absolutely. And you mentioned the COVID-19 pandemic. We are in very unprecedented times right now. So, why is it especially important, Dr. Liburn, to get a flu vaccination during the COVID-19 pandemic?
It's particularly important for communities of color, particularly African Americans and Hispanic and Latino communities, to get a flu shot this season because of how the pandemic, the COVID-19 pandemic, has really disproportionately affected those communities with more severe illness, with more hospitalizations, and even more death from COVID-19. And what we've seen in years past are similar outcomes associated with the flu, because somewhere around maybe 40% of African Americans and Hispanic Latino communities actually get a flu shot annually. And so while we don't have a flu vaccine yet, let me say for COVID-19, we do have the flu vaccine. And that is one way that people who are at higher risk for the flu and for COVID-19 to protect themselves and their families and their entire communities.
Now, Dr. Harris or Dr. Liburn, COVID-19 symptoms and flu symptoms are relatively alike. So when someone is experiencing these symptoms, can they be expected to be tested for both? How does that necessarily work?
Well, for one reason, that's all the more important to get your flu vaccine so that you can have some protection. You are right. The symptoms are very similar. Perhaps with COVID, we are finding that loss of taste and smell is not typical for a flu, but it will be difficult to tell the difference between the two, perhaps early on. And we do have an important tool in the toolbox. Of course, we can wear a mask and watch our distance and wash our hands. Those basic public health measures will help mitigate both. But we do have this additional tool in the toolbox at this time, and that is the flu vaccine.
Great. Now, what can you say to viewers who may be skeptical on whether or not it is safe right now to get a flu vaccination? Where should they get them? When? Talk to me a little bit about that.
So I'll start and just say that CDC has been working very closely with providers, with departments of public health at the state, local, tribal, and territorial levels. We've been working very closely with local pharmacies to ensure that there is a safe dissemination of the flu vaccine. And so people can be confident as they go out, go to their provider, go to a community health center if they don't have a regular source of care, go to a local pharmacy, that measures have been put in place to ensure the safety of the dissemination of the vaccine. So we would also encourage people to, continue to wear their masks, to wash their hands, and to practice social distancing, even as we're protecting against the flu.
Great. Now, talk to me a little bit about cost for flu shots as well. Is it relatively common? I've seen CVS, a lot of pharmacies offering free vaccinations. Can people expect to really get them free anywhere they like?
Well, for everyone who has health insurance, according to the Affordable Care Act, then they can get a flu shot free. For those who are covered by Medicaid, I'm sorry, there may be a minor cost. It would depend on the state. But CDC has also made a significant investment in millions of doses of flu vaccine that will be distributed through primarily federally qualified community health centers, but also local health departments are also a place to go to get a flu shot. And people who are uninsured, they would be able to get a flu shot at no cost from these venues.
Great. Is there anything else that the public should know that either of you would love to add?
Well, I would just encourage everyone to go to getmyflushot.org and they can get information and perhaps plan ahead and call ahead to wherever they are going to find out their costs so that there are no surprises when they get there. And again, this can be, flu vaccine month. This is the best time to get the flu vaccine. We are again early in the flu season. But again, the flu season can last until the early spring. And so there is always a right time to get the flu vaccine, but we do encourage everyone to try to get the flu vaccine this month.
Wonderful. Well, ladies, thank you so much for taking the time to join us today. We really appreciate your insight.